everyone, we've got another specimen today. This is number 903 in our collection. The heart would have sat roughly in the chest like this, anterior surface towards the screen, posterior surface towards the turntable, head or superior here, legs are inferior down here, left and right. So we'll start off as we usually do by trying to identify externally at least what appears to be the right atrial appendage. And here we've got what appears to be an appendage that's pyramidal in shape, triangular in shape, or broad-based, consistent with a right atrial appendage. So we'll go ahead and open up the heart there. And when we do that, we do see pectinate muscles that spill outside the confines of the appendage, consistent with the morphologic right atrium. And we can quickly find the oval fossa, which appears to be intact. What's a little more difficult to find is the coronary sinus. And almost seems like this could be the coronary sinus, but it actually isn't. There is no actual orifice of anything back here, so can't actually appreciate a coronary sinus that opens up into the right atrium in this heart. When we turn our attention to the right-sided AV valve, we do find that it does appear to have 3 leaflets, and there are septal connections of this AV valve consistent with the morphologic tricuspid valve. The ventricle that it opens up into has coarse trabeculations with a septomarginal trabeculation, so consistent with the morphologic right ventricle. And then here, within the Y of the septal band, or between the cranial and caudal limbs of the septomarginal trabeculation, we do find a ventricular septal defect. So once again, here's the septomarginal trabeculation, here's the cranial limb, here's the caudal limb of the septomarginal trabeculation, aka the Y of the septal band, and there is a ventricular septal defect within the cranial and caudal limbs, which makes this an outlet ventricular septal defect. What you'll note right away is that there is some posterior deviation here. And then we come to a semilunar valve. This one has 3 leaflets and has 3 sinuses as well. 1, 2, 3. No coronary arteries arising from it, and a fully muscularly supported valve consistent with a morphologic pulmonary valve. Now, once we come out to the pulmonary trunk here, we see the pulmonary arteries arising from it. And then we do see that this continues out, giving rise to eventually the transverse and the descending aorta. We don't find any suture line here, so it appears that there is definitely a ductal arch that connects the pulmonary trunk to the transverse and descending aorta in this heart. So why don't we go over to the back end? So now we find a more posterior atrium. This one is smooth-walled, consistent with a morphologic left atrium. Once again, we don't appreciate an atrial septal defect from this side. We do find that there is a left-sided AV valve, and it does appear to have 2 leaflets. Here's a posterior leaflet and an anterior leaflet. This does seem relatively small, and you can see that the papillary muscles are also close to one another. So this morphologic mitral valve, we would expect to open up into a morphologic left ventricle. This ventricle does have fine crisscross trabeculations consistent with the morphologic left ventricle. And then as we get into the left ventricular outflow tract, we find the ventricular septal defect that we saw from the other side. So here is that outlet ventricular septal defect that we saw from the right side earlier. So once again, from the right side, the ventricular septal defect that lives in the Y of the septal band, thus an outlet defect. And here from the left-hand side, And the left ventricular aspect lives right underneath the aortic valve. So then we come to another semilunar valve here, which appears to have 3 leaflets and 3 sinuses. And we do see coronary arteries arising from this. So consistent with a morphologic aortic valve, which would make this the ascending aorta. The ascending aorta just kind of abruptly stops, doesn't seem to give off anything in terms of a transverse aorta, which we've seen before actually arose from the pulmonary trunk through what we assume was a ductal arch. So now we've got an interruption of the aorta with a outlet type ventricular septal defect with posterior deviation. So let's just go ahead and take a look at all those features. Once again, here is the outlet VSD, an outlet VSD because it lives within the Y of the septal band. Here is the pulmonary trunk, giving rise to the branch pulmonary arteries, and then a ductal arch that continues on to give rise to the transverse arch and the descending aorta. And then, when we look at this from the left ventricular aspect, once again, we note this VSD, which is right underneath the aortic valve here. And we see an ascending aorta that is not actually connected directly to the transverse arch or the descending aorta, consistent with an interrupted aortic arch. So a heart with interruption of the aortic arch, as well as an outlet VSD.